My name is Paul Reagan. I'm Senator Webb's Chief of Staff. This is Doug Ireland, who is helping the Senator with the health care reform legislation. We're very eager to hear your views. There's a lot of you here, and I would ask that just, you keep your comments as brief as possible. And also, we would like to just hear from the Virginians who are here. I recognize there may be some folks from other states. So if we proceed that way, we can hopefully have a good dialogue and learn something from you as we go forward. Does anybody want to start?
I'll start.
Okay.
Hey, my name is Porter Childers. I live in Fairfax County, and I got a handout. I'm not going to go over that because you can read it. That's not a problem. And I've got everything out of some documentation. If you ever need the documentation, just contact me. I got this information on healthcare costs. It's $2.3 trillion. I added up the unfunded part of the federal government, and it's $1 trillion. So that's 46.5% of the $2 trillion. I don't know how you ask the taxpayers to pay for something, because my experience is in corporate America where we funded all of this stuff like pension plan and health care. And then I look at the out-of-pocket costs, and why does Congress even care about the $200 a month I pay my dentist? And then the employer piece, that's going to get smaller. I know that from experience. And I'll tell you my situation. Hey, I worked for a company that in 1991 took advantage of a tax code section that Congress passed in 1929. Tax code section 501c9. It's called the Viva Trust. The place where I retired from, fully funded in 91. And there's only 30 of us in it. And I write the IRS every year to get a copy of the 990 because that's public information. The 30 of us, our premiums are $180,000. The earnings on the trust is $180,000. And there's $3,187,000 in this trust. The 30 of us will all be dead and there'll still be money in this trust. So I look at it, we're not a problem. And if you go to the IRS webpage, there's over 6,000 Viva trusts in the United States with over $187 billion in it. So corporate America has stepped up to the plate and taken care of their retirees. So we don't, in my situation, I don't need anything. Anything Congress would pass is going to cost me money. So I'll share.
Yeah.
This?
Yes, that would be great. Thank you.
Well, I was just going to suggest that people could go around and give comments, and then we could, where we have some feedback, we could respond to all the issues that you raise or questions that you have.
Okay. Any other people? Yes.
Hi, I'm Donna Corey. I live in Vienna, Virginia. I represent 3 households, 6 voters in the Vienna area. Myself, my family, and my children. And we want the government to stay out of health care. We're not interested in amendments. We want the senators and the congressmen and the president to run the federal government and let us take care of our health care with our doctor and our hospitals. We don't want the government involved in our health care.
Yes, ma'am.
One, I would hope that Senator Webb is reading the Constitution as well as the Federalist Papers. I know a lot of people are trying to justify the health care bill with the General Welfare Clause of Article 1, Section 8. Oh, and I'm Linda Fairman from Yorktown. I drove up from Yorktown last night. The General Welfare Clause, although it is stated in here, however, as Madison points out in his Federalist paper, it's followed by a semicolon and then with 17 specific enumerated powers. Healthcare is not one of the enumerated powers. Neither is a mandate to force the American citizens to purchase anything. Now, my feeling is before Congress decides to create this massive entity of new entitlements under this health care bill, why don't you prove you can fix the fraud, waste, and abuse with Medicare and get Social Security so it's solvent, as well as some of the other federally funded programs? Why are you starting another whole program that would open up a kettle of worms with new fraud, waste, and abuse and excessive spending? Doesn't make sense.
I'd like to remind the Senator that government derives its just powers from the consent of the governed, as stated in the Declaration of Independence. And 61% of the people do not want this. So he does not work for President Obama. He doesn't work for Speaker Speaker Reed, and he works for us.
You're supposed to.
Yeah, I'm Mark Hayward. I'm a physician assistant. I work in emergency medicine and live in King George, Virginia. King George, Virginia is where I'm from. I have a weird perspective on medicine because I came out of the military, which is the ultimate perfect system where everything and now I'm practicing in the private sector. If you put dirt by the curb and say free, people will come along and take 3 or 4 handfuls of it. If you make healthcare super duper low cost, people will use it, and will use it and use it and use it. Like I said, I work in emergency medicine. I see people every day who come in who are on various, they're on Medicare, they're on Medicaid, they're on various community sharing programs. I'm not speaking against those at all. I'm not speaking about many people who are recipients of those programs. But I see plenty of people who, when given an entitlement, will abuse it beyond all recognition. We're talking about the moms where the kid bumps his forehead on a cabinet, I can maybe see a bruise, and mom insists that that kid gets a head CT. Well, I can control costs under a situation like that. I can just make sure that nobody gets a head CT. Or, if I'm forward-thinking enough, I can control costs by saying, these CTs, their utility is unproven, they're vague, they're fuzzy. I say all the things about CT scans that were said 10, 20 years ago. And I just say, well, our federal system is not going to pay for these new technologies. Eventually, we control costs in our system by not reimbursing people to prescribe these life-saving modalities or to develop these life-saving modalities in the first place. Yes, that'll control costs, and that's what we keep talking about with this healthcare reform. We're talking about controlling costs. We're not really talking about improving access to healthcare because anybody in America, regardless of whether they're a citizen or not, can walk into an emergency room, such as mine, and get care. Everybody here has access to life-saving medical care. So when I hear people talking about 14,000 Americans a day die from lack of nutrition, I question a lot of the numbers they're throwing.
Not true.
But the bottom line, as I see it, is this. If I make, as a legislator, if I make enough rules, I can control costs to a certain extent. But in order to do that, I have to have a certain amount of intestinal fortitude. I do not see the Congress as possessing an institutional level of intestinal fortitude that lets them make those hard calls. Frankly, I'm impressed by Senator Webb. I'm impressed by him personally, and I'm impressed by his legislative record, though I don't agree with everything he stands for. But I think it's imperative that the senator votes against this reform program, because if placed in the hand of Congress as the giant entity, where a significant portion of its members are primarily focused on getting themselves elected and re-elected, permanently elected. If placed in the hands of Congress as an entity, no matter how well-intentioned this healthcare reform legislation is, it will wind up being a massive vote-buying program that takes money from my kids and gives it to voters today so that they'll vote the way certain members of Congress want them to vote. I have no good things to say about this program. It is well-intentioned, but as presented, it will cripple our economy and it will cripple us as a nation. Please urge the
Take away our freedom.
That's a helpful perspective. I appreciate that.
And I'm a registered nurse, and there's 2 gentlemen here who know all about insurance, so I'll let them address the financial part of it. But from my perspective, I'm not denying that some reform is necessary, but if this was truly about medical, if the interest of Congress and Senate was truly medical, there would be baby steps. Let's try this, let's try that. You don't throw a bill in and change everything in 3 months. It's insane. And the other part I want to bring up is there are many doctors, outstanding doctors, who are going to leave their profession, and they are telling their children not to go into the profession. There is not enough doctors, nurses, PAs, anybody to take care of the millions of people who who the government want to take care of. It isn't feasible. And so you have to have Senator Webb consider all of this. You take baby steps, you try things, you take care of the ones who are uninsured. All the ones who are insured are basically happy, 61%.
85.
80%. But you take baby steps. This is about power and control.
Exactly.
That's all this is.
Yeah.